It's Lynn, day 15 of my 22 push-up challenge 2.0. Happy Wednesday, everyone. Sorry this video is going up so late, but I had quite a busy day and then a very busy evening at work. I wanted to just talk a little bit about chronic pelvic pain in men. There are a number of reasons men may experience chronic pelvic pain. Men may experience pain in particular during sex or ejaculation or arousal that really highlights the fact that there is pelvic pain that is present that they may not quite recognize when they are not in a heightened state of arousal. This pain may be related to a number of things. A few examples are cystitis, an inflamed bladder, bacterial or viral infection, which may or may not be an STI, irritation of the prostate. Prostatitis is probably a really good place to start if you're looking for information about pelvic pain and you are male. And I would say most certainly if you are a victim of sexual trauma, particularly MST, and you are male, and particularly if you were assaulted with an object. This can cause irritation of the prostate. It can introduce pathogens, bacteria that create infections, scar tissue, perhaps damage to the muscles of the pelvic floor. That can result in congestion and tension that creates the experience of pain. And depending on why that pain is occurring, will determine whether or not treatment is required, and if treatment is required, what treatment or treatments are available to you. I've posted an article on my Facebook that is quite helpful and quite clear. It talks about 6 different reasons why men may have pain related to sex or sexual activity, arousal, ejaculation, or the activity itself. An important thing to note is that you don't have to be a victim of sexual assault to be experiencing pelvic pain. But certainly if you are a victim of sexual assault inside or outside of the military and you are male, this article will be very helpful to you. It talks about some real issues that men experience, and I think that sometimes, because this is our private area, and we are a bit of a conservative society, so I think sometimes when people have different experiences with parts of their body that they don't normally talk about, they don't really, they tend to talk less as opposed to seeking places where they can talk more. Often it's related to embarrassment or perhaps difficulty dealing with potential reasons for their discomfort, such as sexual assault. So definitely have a look at the article. It talks about 6 different reasons why men may experience chronic pelvic pain, or pain related to sex. That's specifically what the article's about. But certainly, yes, if you have pelvic pain associated with sex, I would also caution you to sort of pay extra attention how your body is feeling when you are not in a state of arousal, and try to sort out whether or not you're actually having discomfort or congestion or tension in the area that you hadn't really noticed before. Any kind of discomfort in the pelvic region, particularly if it's related to sex, I would say you certainly should seek the counsel of a trusted medical professional. There may be something that you require just education on. You may need to do a little bit of reading. You may need to change your lifestyle a bit, or you may need an actual medical treatment. So important things to remember when it comes to sexual assault and pain is that pain can rear its head during sex, but it does not always rear its head during sex. It can rear its head at other times and may be related to physical injury or tension or infection, or it may be related to emotional things as well. So some food for thought there. I'm going to do my push-ups now and see if I can get them all in a row. Okay. Okay, I think that was it. My video is going to cut off soon, but thanks everyone for watching. Thank you for being part of this really important conversation. I look forward to talking to you tomorrow. Day 17 of my 22 push-up challenge 2.0. Protect the protectors, love our veterans. Remember, MST is real. Ciao for now, people. Gonna do a little bit more work and try to help us understand pain a little bit better. Okay, talk to you tomorrow.